family planning viva, one of the important methods of contraception are IUCD or an intrauterine contraceptive devices. Normally, the examiner will give you this and would expect you to speak something about it normally. So this is if you see closely, this is a multi-load copper-T. So some copper-T is given to you, handed over, and they want you to speak about it. So normally IUCD or an intrauterine contraceptive device is a spacing method. It's the best spacing method, which is one of the best spacing methods which is available. That means it helps couple plan the next pregnancy at a gap of 2. So if she has delivered today, or she has undergone an abortion, or if she doesn't wish to have immediately another baby, then this is an ideal spacing method for many of the couples. So that's first thing which you should be knowing. Second thing is, what is intrauterine contraceptive device? It is a device which is actually inserted or kept inside the uterus, and hence because it is kept inside the uterus, the mechanism of action is one, that it has a foreign body inside the uterus, so it prevents implantation. It causes some kind of local inflammation in the endometrium, so it doesn't make it makes the endometrium not very conducive for implantation. Then hi, good morning. I'm sorry for again delaying this video, but today we are going to speak something about or learn something about IUCD. Now, you all know that intrauterine contraceptive device is a very important topic in undergraduate as well as PG Viva. Some basic must-knows about IUCD we will be discussing today, like what is an IUCD, what are the generations of the IUCD, what are the basic category or the division of IUCD, how does it work, what are the indications for insertion, when to insert, what are the contraindications, in which cases it should not be inserted, and how exactly to insert. And also copper-T releases some local prostaglandins, which also again helps in kind of causing inflammation and hence prevention of pregnancy. So many times you are asked, what are the various generations of intrauterine contraceptive devices? So in history, it is seen that Arabs and Turks used to put pebbles inside the womb of the camel so that she did not become pregnant while they were traveling. So that's where the history goes, that first time where this concept of intrauterine foreign body insertion was used actually. So we have come a long way, and now the first generation intrauterine contraceptive device is of inert material, which is like Lippy's loop. Now it is not used anymore, but it was absolutely it used to work by acting as a foreign body. The second generation, which is most commonly available, is the copper devices. So the copper is a very strong inflammatory agent, and once put inside the uterus, foreign body, it works with foreign body as well as causing a lot of inflammation inside the uterus. The third generation of IUCD is what is usually used is a multi-load copper-T. What we just saw was a multi-load copper-T. So if you see the copper-T, it has its two arms have these serrations, and these are multi-load copper-Ts. So the method of insertion of multi-load is little different than the regular copper-T. Normally the way we insert a copper-T is by withdrawal method. So that means we insert the copper-T inside the uterus and we fix the plunger. There is one plunger we fix and the sleeve is pulled out. This is withdrawal technique. Whereas this is a partial withdrawal technique. You just have to slip it inside the uterus and gently release the sleeves, opening both the arms inside the uterus. So the chances of displacement and falling in these copper-Ts is much lesser. Then the fourth generation, which is the recent intrauterine contraceptive device, is Mirena. And Mirena or Emily, there are various brand names which are available in the market, and that copper-T contains progesterone. It is one of the best available intrauterine contraceptive devices, and it has a lot of benefits. Along with the first one is obviously being that it is a contraceptive method. Second, it many times reduces bleeding, it reduces endometriosis, it reduces backache, it is very helpful even in a women who are bleeding very heavily or cases of DUB or other. The properties can also be classified as hormonal and non-hormonal. So most of the properties till generation third are non-hormonal. They contain either they are inert or they have copper, which is a chemical. Only the fourth generation, that is the progesta CuT or a Mirena, or the ones which have levonorgestrel intrauterine contraceptive devices, only these are hormonal IUCDs. The indication of intrauterine contraceptive device is the ideal, as we have already mentioned, is between when we are planning to space between two kids, and the property, the how effective it is or for how long can we keep a property depends on the variety of property. So it can be anything from like 3 years, 5 years, 7 years, 10 years. Mirena per se can be used for contraception for 8 years. So it is very, very effective property, although it is costlier than others, and many of the properties are provided free of cost from the government. Property can be even trained nurses can in PHC or periphery, even trained nurses can insert property. So property is special trainings or training camps are organized for these paramedical staff, so that property can reach even in the rural areas of the country. Now, when to insert a property? Insertion of the property is ideal insertion would be between 3rd to 5th day after period, so that we are certain that there is no pregnancy inside. But it can be, you cannot deny a patient property. Whenever she comes, in case she comes on any other day, just confirm that she is not pregnant, and then you can insert a property. Why do we prefer on 3rd to 5th day? Because there is some bleeding still and the os is a bit soft and open, so it becomes technically little easier for insertion. But and sometimes if the thing is very painful, there might be mild dilatation which is required, so it becomes painful, so you sometimes require a paracervical block or something. But in usual practice, we prefer to call the patient on 3rd or 5th day. Many times it is done along with MTP. When we are doing an MTP, suction evacuation, or DNC, many times we insert a property under anesthesia, which becomes fantastic. Now when we put a property, follow up of such patients becomes very important. So normally we call immediately after the first periods, because that's the time when the displacement of property is quite common. So we want to know after the first period, we'll check the patient, we'll do a per speculum examination and confirm the property. And we can also ask if the patient is tolerating the property well. There can be little bleeding or little crampish pain initially in first, second or third cycles, but as the body gets used to it, it becomes very comfortable and she'll not be aware. So it doesn't require motivation every time. Once you have inserted the property, she is good to go. Which are the patients where property should not be inserted is also very important to know. So any woman having suspected pregnancy, property should not be inserted. A woman who is having irregular bleeding, vaginal bleeding, property should not be inserted. In a woman who is having any pelvic inflammatory disease, purulent discharge vaginally, property should not be inserted. Any suspected case of malignancy, again property should not be inserted. And if there is a uterine cavity which is distorted, again property is contraindicated. There are some other cases also where property, while you're using, you should be very careful. Like if a woman is of trophoblastic disease, say vesicular mole or a choriocarcinoma or something like that, again it becomes very difficult that why the bleeding is occurring. So such patients should be, property doesn't become the first choice for such patients. Or even in patients of heart disease, you have to be very careful before deciding that you want to give the put a property for such patients. So they are not absolutely no, but you have to be very careful and justified in why you put a property for such patients. So there can be reasonable restrictions are there for when you're using for some special cases of property in such patients. So how are these patients followed up? Normally, as we have already mentioned, that first follow-up is usually after first period, and thereafter maybe the first time we'll call after 3 months, and thereafter 6 monthly till the whatever is the duration of property. So if the property is for 3 years, we'll call every 6 months till 3 years, and then probably remove, and depending on if the patient wants to have pregnancy or she wants a replacement of property or wants to choose some other contraceptive method, accordingly we will decide what next to be done. So normally follow-up is very, very important if the property is in place. Another thing which you should know about property is that sometimes So this video covers absolute must knows about copper T. I expect you all to return back and read in detail about copper T. Coming to some complications which can occur. Some complications occur while we are doing this procedure inside the OPD. So it might be very difficult to insert a copper T in few cases where we again call the patient maybe during menses, or maybe we do the procedure inside the operation theatre under anesthesia. So that's one. Most of the time, 99% of the time, copper T can be very easily inserted inside the OPD. So it's an OPD procedure. Second thing, that patient might have a lot of pain, or there can be some bleeding, or there can be chances of perforation, or there can be chances of sometimes patient having severe vagal attack. So it should be very carefully inserted inside the OPD setup. Now something which is very important to remember is that copper T requires a consent of the patient. So prior to insertion of copper T, a proper consent should be taken, and patient should be counseled in detail that she will have to come regularly for follow-up. There can be some mild pain and bleeding in initial cycles. She has to report to the hospital in case she misses her period, and she can periodically check her copper T. So she can just insert a finger inside the vagina and check for the thread, and to report immediately in case she cannot feel the thread at all. So at the end, let's cover some basic complications which can occur while insertion of copper T. It can be pain, it could be bleeding. The copper T might there can be a perforation, which is very important to look for. Delayed complication could be pain, bleeding, cramping. Sometimes the copper T gets expelled, and the worst sometimes is misplaced copper T. And I want you all to go back home and read properly about how to manage a case of misplaced copper T, along with reading copper T in detail. So I hope that you have understood something about copper T. Once the copper T is inserted, the post-copper T insertion counseling is very important for such patients. She has to be informed that she has to check her pad during her menses to see if there is any copper T which is expelled. She has to follow up monthly for 3 months after the copper T is inserted, and thereafter every 6 months. She's also advised that in between she can just insert a finger and check for the thread. So that reassures her that the copper T is well in place. If she feels any part of the copper T coming into the vagina or the thread missing, she needs to see the doctor immediately. Also, there is some failure rate, although less, but there is a failure rate of copper T. Anytime she feels that she misses her period, she is supposed to see her doctor immediately. So these are very important things, and there can be some pain and bleeding initially. So it all depends. The acceptance of copper T depends on how well you counsel the patient. You have to tell her that these are the problems which will happen initially, but once the copper T settles inside the body, it will be she will not feel any it is very comfortable then. Another thing, in case she experiences any pain in lower abdomen or any purulent discharge, she needs to see the doctor immediately.